Hello, welcome to our Spina Bifida educational video tool. We have created this audiovisual tool to be used as an electronic resource that echoes information you heard in your prenatal visit. We hope you will use this tool throughout your newborn's many stages of development. By now, you probably feel like your pregnancy has been filled with appointments and medical discussions, OB visits, diagnostic ultrasounds, an in-depth prenatal visit at the Spina Bifida clinic, and the vast amounts of medical education regarding what spina bifida is. It is common to feel overwhelmed, stressed, or nervous, but let's focus on the excitement of a new baby joining your family. Please be reassured, we will be here to help guide you through this initial education process, and we will be here for you as a reference for when new things come up with your developing newborn. We are here for you. Primary Children's Hospital in Salt Lake City, Utah has provided dedicated, specialized care for children with spina bifida since 1954. We will work as an interdisciplinary team to advocate for your child and family. We want you to know you are in good hands. Here's what we will cover in this educational tool. A brief reminder of why spina bifida occurs. What does a child with spina bifida look like? How will you help your child with spina bifida on a daily basis? Bladder management, bowel management, development of your child and early intervention, orthopedic management, neurosurgery specialty concerns, management of hydrocephalus, Chiari malformation, a special discussion, how to care for your child after surgery, general health concerns with children with spina bifida, and lastly, where can I turn for more help or information? For future quick reference, you may fast forward the video to a specific time of each section as listed here. Let's briefly discuss why spina bifida occurs. Spina bifida is a neural tube defect which arises when the spine of a developing baby fails to close very early during pregnancy. At this point, you have likely seen a picture of your baby from ultrasound and fetal MRI. By examining the location of your child's suspected spinal defect, your medical team can help predict what assistance your child may need. Spina bifida is one of the most common birth defects in the United States. Furthermore, 95% of children born with spina bifida are born to couples with no family history of these defects. We want to reassure you, you did nothing to cause this defect. We also want to briefly discuss your future family plans. Now that you have a child with spina bifida, there is a low reoccurrence risk for spina bifida with each subsequent pregnancy of approximately 2 to 3%. However, great research has been conclusive that this risk can be significantly reduced by up to 40 to 70% by the mother taking 4 milligrams rather than 400 micrograms of folic acid at least 1 month prior to conception. So when you're ready to think about another pregnancy, please plan to talk to your OB/GYN or the Spina Bifida clinic to get a prescription for this high-dose folic acid. So what does a child with spina bifida look like? This is a common question from parents after the multiple discussions of the different medical interventions children with spina bifida may need. The truth is, your child with spina bifida will look like you. Brown or blonde hair, blue or hazel eyes, freckles, they are your child, and they will likely have features from either side of your family tree. Other physical features will depend on your child's level of spinal defect. There are 4 main areas where spina bifida will likely affect your child. Children with spina bifida may have hydrocephalus, which means water of the brain. We will discuss this diagnosis in more detail later in the video. Spina bifida children who have been treated with hydrocephalus may have visible surgical scars. Almost all children with spina bifida do not have nerves to the bladder and bowel. This means that your baby may not be able to empty their bladder and bowel completely, so your child may need help with toileting. With spina bifida, there are fewer nerves to the legs and feet. Because of this, some or all of your child's leg muscles may be paralyzed or not function as well as they should. Children may also use a variety of orthopedic devices or wheelchairs. The next section of this educational tool will discuss how you will help your baby with spina bifida on a daily basis. These are the common areas children with spina bifida need help: bladder management, bowel management, early intervention and development, and lastly, assistance with orthopedic management. Spina bifida affects a child's urinary system and the ability to control the bladder. A poorly working bladder can result in permanent damage to the kidneys. Your baby's bladder management will include careful checking of the bladder and kidneys throughout their development. The urologist is the physician who specializes in problems related to the urinary tract. Helping your baby get appropriate testing for their bladder and kidney function will be a priority for the first few days after your child's born. This process will begin in the hospital right after your baby has entered the world. Once your baby has been admitted to Primary Children's Hospital, the nurses will place a catheter into the bladder to continually drain your child's urine as to not cause any pressure on the kidneys. In the next few days, this catheter will be removed and intermittent urinary catheterization will begin, initially every 6 hours and then as tolerated spaced out to every 8 and 12 hours. This is done to ensure your baby is fully emptying their bladder and their kidneys are functioning well. Most infants do not need to be catheterized when discharged from the hospital. As your child grows into a preschooler, we will begin to address the concepts of social dryness as necessary. Other things you will need to monitor for are the red flag signs and symptoms of a urinary tract infection or UTI, which include chills or fever, foul-smelling urine, cloudy or dark urine, blood in urine, nausea or vomiting, pain in back or lower part of the belly, discomfort with catheterizations, if your child has clean intermittent catheterizations, change in urinary continence, such as leaking or accidents, or other general signs of illness, such as not eating or not responding as usual. For questions regarding other bladder management problems, please refer to your Spina Bifida family notebook or other links provided here. Almost all children with spina bifida, even those who can walk, have trouble with bowel control. The bowel, also called the intestines, absorbs nutrients from your food. Spina bifida affects both the internal and external sphincters of the bowel. Nerves that control these sphincters are the lowest on the spinal cord. Because of this, an opening anywhere along the spinal cord can cause these nerves to not work. The internal sphincter may not be able to detect the presence of stool and does not send the message to the brain. The external sphincter may not get the message from the brain to hold or release stool. As a result, stool is not eliminated from the body. This means children with spina bifida do not know when their rectum is full and needs to be emptied. What are you going to worry about in the newborn phase? Prevention of constipation. This is done through nutrition of your infant. Either breast milk or different types of formula can be used. Breastfed infants usually do not have difficulty with constipation. Different formulas can be used to help your infant pass stools without difficulty. A dietitian assists patients with special dietary needs. Optimal nutritional care through educational counseling is provided for each family. Possible bowel problems include fecal impaction. If your child is constipated often, impaction can occur. This is when large clumps of stool collect in the colon, which make it harder to pass the stool at all. Sometimes impaction causes diarrhea-like stool as the liquid stool leaks around the larger hard stool. Children with spina bifida may have diarrhea because of illness, certain foods, or anxiety. Again, they may also have diarrhea because of impaction. This is because the weak external sphincter allows stool to leak anytime there is stool in the rectum. Skin problems and diaper rash can result from constipation and diarrhea occurring frequently. You can treat diaper rash by leaving your child's diaper off during nap time. Increasing air to the child's skin will improve healing. You can also use the following methods to prevent or treat diaper rash. Keep your child's diaper area clean and dry by changing the diaper every 1 to 3 hours or whenever the diaper is wet or soiled. When you change your child's diaper, Wash the area with clear water. If your child has a bowel movement, use baby wipes free of alcohol or fragrances and then pat dry. You always want to make sure you clean in the folds, wash girls from front to back, and if your boy is not circumcised, gently pull his foreskin back, clean the area, and then replace the foreskin. You can apply a thin layer of protective ointment to protect the skin from ammonia irritation. Apply the ointment only to thoroughly cleaned skin. You do not need to scrub the ointment off every diaper change. Rather, remove the urine or the stool and then add more ointment. Contact your pediatrician or the Spina Bifida clinic nurse if your child's diaper rash does not improve in 2 to 3 days or your child's rash is looking infected. We want to ensure that your child develops in all aspects of their life. This includes areas such as speech and language development, fine and gross motor development, and social interactions. Let's first start with meeting the team that will help monitor your child's development and need for early intervention. A pediatrician is a physician who specializes in the care of children. The pediatrician in the Spina Bifida clinic manages general health problems related to spina bifida, in other words, developmental issues, growth issues, and skin care. Well child care, preventative care, immunizations, routine physical examinations, and the treatment of childhood illnesses is provided by a community-based pediatrician, family physician, or nurse practitioner selected by you. An occupational therapist evaluates a child's developmental skill, muscle tone, perceptual motor skills, play, activities of daily living, and adaptive equipment needs. The information is vital as assessing the need for intervention and or referral to a developmental program or outpatient services. A physical therapist assists in evaluating the child's motor ability. A manual muscle test is given at the first clinic visit and is repeated approximately every 3 to 6 months. The physical therapist monitors the patient's status and makes recommendations regarding the need for home programming, outside physical therapy services, and/or equipment. Physical therapists work with your child to walk with the use of braces, walk with an assistive device such as a forearm crutch or a walker, or the use of a manual wheelchair or the use of a power wheelchair. How will you interact with these providers in the newborn phase? This early intervention team will help monitor your child's development from birth and on. The therapist, together with your providers, will discuss readiness to sit, crawl, stand, and walk. How to access early intervention. From birth to 3 years, early intervention is accessed through your local county. In your Spina Bifida family notebook, there is a list of early childhood intervention services and their specialties. How can you help your child's development? Spina bifida may cause your child to have learning problems. You can help your child by changing play into learning and therapy at home. You will be guided how to help your child's specific needs. Additionally, you can read to your child every single day and improve their language skills. Who is on your orthopedic team and what do they do? An orthopedist is a physician who specializes in problems related to bones, joints, and muscles. The orthopedist may use surgical approach for treatment of deformities, but often uses a combination of surgery and bracing. An orthopedist who specializes in the treatment of spine deformities is also available in the Spina Bifida clinic. An orthist is a person who specializes in making braces and other orthopedic devices. This individual works closely with the orthopedist, fitting and making braces as prescribed. The orthopedist will guide you when and where bracing is needed. As discussed earlier, in children with spina bifida, the spine, hips, legs, and feet often do not develop or work properly. This requires orthopedic management, which includes careful assessment of these areas. The goal is to increase your child's function and independence. There are several common orthopedic problems that may occur in children with spina bifida. In the newborn phase, the following may occur. Club foot. Children with spina bifida may be born with a foot turned inward. The outer part of the foot is curved and the ankle is bent downward. Surgery is usually performed after 6 months of age. Clubfoot correction surgery adjusts the position of the foot bones and lengthens or releases the tendons to allow the foot to go back to the correct position. Release is a type of surgery that frees up a part of the body so it has better movement. Children need braces after surgery. Some infants with clubfoot have a cast put on their foot and do not need surgery. This casting happens soon after birth. The orthopedic surgeon changes the cast every 1 to 2 weeks. This is called serial casting. Who is the neurosurgery team? The neurosurgeon is one of the first faces you likely met regarding your child's spina bifida. Let's talk a bit more specifically about what a neurosurgeon's role is. A neurosurgeon is a physician who specializes in the surgery of the nervous system. A neurosurgeon performs the surgery to repair your baby's back soon after birth. This physician will also do the surgery of a placement of a shunt or a third ventriculostomy. We will discuss these diagnoses shortly. But first, let's refresh our memories of what hydrocephalus is. Hydrocephalus means water of the brain. It happens when too much fluid collects in the cavities or ventricles of the brain. Most babies with spina bifida develop hydrocephalus. Treatment in the newborn phase includes shunt placement, ventriculoperitoneal shunt, or third ventriculostomy and choroid plexus coagulation. Let's talk about shunt placement. This is a surgical procedure in which the neurosurgeon puts a shunt or a tube in the ventricle of the brain to remove the excess fluid. The tube goes from your newborn's brain into the peritoneal cavity, which is a space in the belly where the belly organs are. The fluid flows into this area and then is absorbed naturally into the veins. Your medical team may consider a third ventriculostomy with choroid plexus coagulation for treatment of hydrocephalus. This is a surgery where the neurosurgeon makes a small opening in the bottom of the third ventricle of the brain. This lets the fluid of the brain exit the ventricles at the same time as decreasing the amount of spinal fluid produced. This is a way to treat hydrocephalus without a shunt. Before the surgery, your baby will have an MRI brain scan, and the neurosurgeon will look at it to determine if this is right for your baby. Once your child has a shunt, we will want you to monitor for the red flag signs and symptoms of a shunt malfunction. A shunt malfunction could be a partial blockage or complete blockage or infection. A shunt complication may present with the following symptoms: headache, vomiting, irritability, or sleepiness. Infants can have these extra symptoms: swollen or raised soft spots, fussy, irritable, or high-pitched cry, feeding problems, and symptoms of a shunt infection may include fever, redness, or swelling along the shunt track. The shunt track is the place where the shunt is under the skin. If your child has these symptoms, or if you have any concerns, call your doctor or go to the nearest emergency room. What is a Chiari malformation? In Chiari malformation, the brainstem and cerebellum are pushed down because there is less space in the brain. Because the normal flow of fluid is blocked, it builds up and increases pressure on the brain. There are 4 types of Chiari malformation. Type 2 is associated with spina bifida. How do we know if your child has a Chiari malformation? We will look for this information on your fetal ultrasound and MRI. Just because your child has a Chiari malformation does not mean they will have symptoms of the Chiari. We will ask you to watch for the following symptoms as listed in the table as your child grows. This is rare, but this could be a sign that your child's Chiari is now symptomatic and may need treatment from your neurosurgeon. A special discussion: how to care for your child after surgery. Your baby's first surgery will likely be to close your baby's spinal sac. The baby will be admitted for 5 to 7 days to either the infant medical surgical unit or newborn intensive care unit at Primary Children's Hospital. The neurosurgeon will discuss the treatment plan for your baby with you. After the surgery, your baby will recover under the supervision of our interdisciplinary medical team. The nurses will hook your baby to monitors to check for signs of increased pressure in your child's brain due to hydrocephalus. This will include monitoring your baby's heart rate, respiratory rate, and blood pressure. Your baby will have a dressing on his or her back from the surgical site. and your child will be resting on their stomach. If your baby does demonstrate hydrocephalus, the neurosurgeons will discuss treatment options including either a shunt or third ventriculostomy and choroid plexus coagulation. Many babies with spina bifida may go home from the hospital before having either of these procedures, but your child will need close follow-up with a neurosurgeon and spina bifida clinic and their pediatrician. The nurses will closely monitor your baby for signs of pain postoperatively. Your baby may be on IV fluids or intravenous fluids for hydration and nutrition until your medical team feels it is safe for your baby to eat. We want to encourage you to pump breast milk for your baby if you are planning to later breastfeed. The nursing staff will assist you to breastfeed your baby when the medical team feels it is safe and your baby is ready. With subsequent surgeries, parents often want to know what they can do to help their child. We want to encourage you to be with your child. Advocate for their likes and dislikes when possible. Comfort them when in pain or nervous. You, as the parent, are an essential team member of the medical team, and we trust you and understand that you know your child best. Other postoperative care that may be needed after you and your baby leave the hospital may include surgical incision dressing changes, pain management with prescription or over-the-counter pain medicine, and increasing feedings back to your child's baseline. General health concerns with children with spina bifida. General skin care is essential to any child's health. Babies with spina bifida are more prone to skin problems because they have limited movement, weak muscles, lack of feeling, and poor circulation. Additionally, your baby may have skin breakdown related to medical devices. Monitor for redness, rubbing, dryness, and need for new devices as your child grows. What do you do if your baby catches a cold? Your baby will likely catch seasonal illnesses. You will need to treat these the same way that you treat other children with illnesses. Encourage hydration, monitor fevers, and help your child manage the symptoms. You will just need to monitor for signs and symptoms of red flags as discussed throughout this educational video. If you are ever concerned about an illness, you can contact your local pediatric provider or the spina bifida clinic. What about vaccinations? It is recommended that your child receive all the standard vaccinations at the standard times recommended by the CDC. Latex allergies can occur in any person. However, some children are more likely to become allergic to latex than others. This includes children who have spina bifida. Thus, we encourage avoiding possible exposures, such as avoiding latex balloons. We will also use medical equipment that is latex-free for your child, including urinary catheters. Where can you turn for more help and information? We want you to refer back to this video as your child continues to grow and develop, or as new challenges arise. We also want to continue to refer to your Spina Bifida Family Notebook. The Spina Bifida Clinic is always available to answer any questions or concerns you may have. You may also look at the Spina Bifida Association National website, or you may see that there are local support groups including the Intermountain Spina Bifida Support Group and local Facebook Spina Bifida family groups. Thank you for watching our Spina Bifida educational tool.